Hey everyone, happy Wednesday night, week 8, 9, 10 of the pandemic. Getting ready for the memorial service on Sunday. And I've been thinking a lot about who thrives during really hard times and who crashes during hard times. And I was having a conversation with my niece, who's 10, and I was trying to explain to her this concept of kindling. And she grew up in an unpredictable, hard environment. In fact, I write about her and her sister. I dedicate them. My book, The End of Mental Illness, I dedicated it to them because they're loaded for mental illness. They have a family history of anxiety, depression, multiple suicides, bipolar disorder, schizophrenia, addictions. But as we know, genes only load the gun. It's what happens to us that pulls the trigger. And they were raised with a fair amount of chaos, with multiple moves in schools. And about 4 years ago, they were taken by Child Protective Services into foster care, where yet more traumas occurred. And she's really a great kid. I mean, I love having her with us. And we were driving over to my mom's and talking about grief and how people react to certain situations. And I'm like, so how do I explain how the nervous system gets hijacked by the traumas in our past? And so I said, I'm going to teach you a concept, and I want to see if you can understand it. And it's called kindling. And it's a neuroscience concept. But think of kindling wood. Do you know what that is? And she did. You know, it's basically shavings from wood that make it really easy to start a fire. I said, well, that's sort of what kindling means. And in a neuroscience standpoint, or a brain science way, if we take a nerve cell and we put it in a dish, and we pass an electrical current through it, nothing happens. But if we increase the energy, pretty soon it fires off. And if you keep that energy high enough, for long enough, this nerve cell becomes what we call kindled, and you can actually lower the energy and it still fires off. I said, when you're raised in an unpredictable environment where there's scary things, where there's scary things that happen, your emotional brain becomes hyperactive because it causes you to have to watch. And if there's enough unpredictable events, pretty soon your nervous system becomes kindled. Then even little tiny things, like maybe a look from me that didn't actually mean anything, all of a sudden it makes you feel bad. And your nervous system has been kindled and it becomes hyperactive. And so our job is to stop the past from infecting the present. And so there's some tricks. Is it then or is it now? And when you get upset about something, take your hands and just stroke down your shoulders. It's alternate hemisphere stimulation that just can soothe your brain. Meditation, diaphragmatic breathing, all of those things can be super helpful. And then we talked about, so who thrives during hard times and who crashes? And there are a number of big things. And some of it's luck, no doubt. If you are able to keep your job and work from home and have an income, that's clearly better than not. So some of it is just the needs of day-to-day life. If in your mind you think this is permanent, you're going to have a much harder time than if you think it's temporary. Now, temporary may not be 10 minutes. Temporary may be 2 years. Things are going to be different. Maybe for 2 years. It's not just going to go away tomorrow. And maybe it'll be 4 months. I don't know. I can't predict the future. But I know this isn't going to last forever. But people who feel like this is it, it's always going to be this way, I'm never going to be able to get ahead, that black or white thinking, it's going to make it much harder for you. So the first thing is it permanent or temporary? And the people who thrive know it's temporary. Now, yes, some bad things are happening. I lost my dad, that's permanent. But how I react to that is temporary, that things are going to change and I can make good decisions that help me integrate him into my own brain, if you will, or I can make bad decisions. And I'm working really hard to make good decisions. And so knowing I won't always feel awful is really important. So, temporary and local. It's this specific time when people see it as everywhere, everything is awful, you're going to crash. As opposed to, these are the specific things I can do that affect me now. You're going to do so much better if you see it as local rather than global. And then the third thing is your sense of control. How much control do you have will determine if you thrive or if you crash. Now, I obviously have no control over what the governors of the 5 states I have clinics in, but I have control on how we respond. I have control on what time I go to bed, what time I get up, what I eat during the day, how much I exercise, the decisions that I make. And so during this pandemic, I felt like I had a lot of control. And I kept telling myself, are you going to feel good about how you acted in September? And now maybe it could be next September. But what's your sense of control? If you see they doing it to you, you're going to be very unhappy. What is it you can do to thrive during this time? The fourth thing is they purposefully take their mind to a healthy place. And so we've started to introduce strategies and routines. Like, we're not talking about the pandemic at dinner. Dinner's actually turned out to be the most special time for us as a family. So talk about it in the morning, but it's not something that pervades every conversation. Mental discipline is so important. And when this first started, I talked about mental hygiene is just as important as washing your hands. Another habit we have is everybody in the house, or 6 of us, you're allowed a tantrum a week. So, we're into this 9 weeks or so. Well, you could have had 9 tantrums and we wouldn't be upset. It's a pandemic. It's okay to have a tantrum, just not every day. So if you need to cry, if you need to mourn, if you need to grieve, absolutely want you to do all of those things. And I think maybe everybody's had 1 or 2. So just have the expectation things aren't going to be perfect, because they are not going to be perfect. And then the 5th thing, which is so important, and I'm sort of irritated that our leaders aren't talking about this, is we need to get physically healthy as a population. And the United States has 4% of the world's population and 1/3 of the COVID-19 cases, and more mortality than many countries. And we're supposed to be the wealthiest country in the world. But when it comes to longevity, I think we're about 35th. Or overall health, we're like 30. That means 30 other countries are healthier and live longer than we do. We need to address the elephant in the room. As a society, Americans are not healthy. And in the end of mental illness, the big idea is, if you want to keep your brain healthy or rescue it if it's headed to the dark place, you have to prevent or treat the 11 major risk factors that steal your mind. Hello, Patsy. I see you. Thanks for tuning in. You have to prevent or treat the 11 major risk factors that steal your mind. And we know what they are. And oh, by the way, these 11 risk factors are tied to, if you get COVID-19, you are more likely to die. And I created a mnemonic for them called Bright Minds. And just today, the N was in the news. So let me just walk you through Bright Minds quickly. B is for blood flow. Low blood flow is the #1 brain imaging predictor of Alzheimer's disease. It's why we do brain imaging at Amen Clinics. How do we know what's going on in your brain unless we look? And the risk factor for low blood flow is hypertension. As blood pressure goes up, blood flow to the brain goes down. And 60% of Americans are hypertensive or pre-hypertensive. 60% of us. The R is retirement and aging. When you stop learning, your brain starts dying. And the older you get, the less blood flow do you have to your brain, and the higher your risk is for Alzheimer's disease, but also isolation, depression, loneliness. And it's a risk factor for COVID-19. The I is inflammation, which comes from the Latin word to set a fire. It's like you have a low-level fire in your body, destroying your organs, and people who have inflammatory conditions like autoimmune disorders have a higher incidence of mortality. You also have a higher incidence of depression and dementia. The G is genetics, but genes aren't a death sentence. They tell you what your vulnerability is. I have obesity. in my family, but I'm not obese. Why? I know it's a risk factor, and I manage how many calories and the quality of calories I put in my body every day. H is head trauma, T is toxins, M, mental health issues. The second I is immunity and infections. Prophetic. When it comes to this COVID-19 thing, infections can really do a number on your brain. And we know COVID-19 can. One of the early symptoms was you lost your sense of taste and smell. That's a brain issue. There are issues with headaches and dizziness, seizures, bleeding in the brain. All of those things are related to brain health. And your best defense against this pandemic is your immune system. Your best defense is your immune system. So working hard to optimize your immune system is so important. And people who have infections or autoimmune disorders have a higher incidence of mental health challenges. The N is neurohormone deficiencies. And in the paper today, there are studies out of Germany that males who have low testosterone have a higher incidence of problems from COVID-19. And I have to tell you, I've seen an epidemic rise in low testosterone among young men. I think it's all the toxins their parents put on their bodies. And in older men, often from concussions. I published a big NFL study when the NFL was sort of having trouble with the truth about head trauma. We've scanned and treated over 300 NFL players. A very high percentage of these macho, monster, muscle guys have low testosterone. And I think it's because of the repetitive trauma going on to their brains. So hormone abnormalities, the N is neurohormones, D is diabetes, which is just a scandal in this country. 42.4% of people are obese, not overweight. That number is now above 70%. We need to get serious about getting to a healthy weight, and it's not going to be Nutrisystems. I just want you to read the label, read the ingredients. This is not natural food. Anything that shows you donuts and brownies and weight loss, something's not quite right. Eat whole food is critically important. And I was on the radio last week in London, and this woman called up, and she's in the vulnerable group. She has rheumatoid arthritis. And the host, I think he has me on because he thinks I'm a psychologist. And because I'm always trying to mess with the medical part of the questions. And so he wanted to go, what's the psychological impact of having rheumatoid arthritis during a pandemic? And my question was, why does she have rheumatoid arthritis? Why is her immune system angry at her? Autoimmune. Your immune cells are attacking your own body. Why? Is it she's got an allergy to gluten, to dairy, to corn, to soy, to artificial dyes, sweeteners? Does anybody ever put her on an elimination diet? What's the health of her gut? Does she have leaky gut syndrome? And I just felt like I was talking Greek. I often feel like that. There's so many ways to treat. And, too often in medicine, we go, you have this, so let me give you that drug. And I'm just not a fan of it after doing this for 40 years. I'm really a fan of, well, why do you have that symptom? What's causing that symptom? And is there something we can do about it? I mean, I'm not opposed to medicine. I'm just opposed that's the first and only thing you do. Like all these people with diabetes, 50% of the population, 50%, are either diabetic or pre-diabetic. Don't you think somebody should be changing the food? and getting rid of the toxins in our environment, if we're having this epidemic rise of obesity, diabetes, hypertension, why are we spending trillions of dollars to, support the pandemic? But no one's even talking about, shouldn't we spend some of this money on prevention and treatment? But mostly it's changing the way we live. But when pharmaceutical companies and the fast food industry have massive lobbies that are not interested in this, unfortunately, it doesn't even make the discussion. When Dr. Fauci and the others were in front of Congress this week, nobody's talking about this. And I hope there's a vaccine. I'm a fan of vaccines when they're appropriate, but there's still not an AIDS vaccine. And that's been around for 40 years. Your best defense is your immune system. And the S is sleep. Whenever people ask me about my routine, I always start with, it starts the night before. By getting a good night's sleep, I'm turning on 700 health-promoting genes. So, temporary, local, a sense of control, mindset, and then getting your brain healthy. That's the difference, I believe, between people who can thrive during a pandemic versus those who crash. I hope you found this helpful. I look forward to seeing you every day. I'll see you soon. Take care.